Thank you and welcome to another ACTEC Systems webinar. The topic today, FMLA and absence management, turning a weakness into an opportunity. Before we begin, let's talk briefly about your technology today. Your lines are muted for the duration of the webinar. You can ask questions at any time in your question box. You can close and open the webinar control panel using the arrow, but don't click the black X or you'll exit the webinar session. Now allow me to introduce the sponsor of today's webinar, Paul Nelleman from ACTEC Systems, a nationally renowned authority on absence management reporting. And with that, Paul, the floor is yours.
Thank you. It is with great pleasure that I introduce our speakers today, John Hearn and Michael Godwin from TBX Benefit Partners. They specialize in helping large employers unlock the potential within their absence management, life, disability, and other ancillary programs, with a particular focus on leveraging solutions in these areas to drive positive productivity outcomes. We began working with TBX about 5 years ago when we had large clients wanting total absence management solutions previously not available in the marketplace. And with that, I'd like to turn the floor over to John Hearn with TBX.
Thank you, Paul, and thank you for everyone attending today. As Paul said, my name is John Hearn with TBX Benefit Partners, and our topic today is on leave management, turning a weakness into an opportunity. This discussion will be less about the compliance details. Many of you on the call, as well as us, have attended many sessions, important, good content sessions put together by attorneys and other experts dealing with the finer points of FML compliance. This discussion is going to be more about a different perspective on building a foundational process that keeps in mind the perspective of all stakeholders in an organization. In short, we'll be moving from what the traditional industry wants to sell you, which is put things into silos, over to what your entire organization needs. The first couple of bullet points on this slide from a discussion point standpoint include bullet points that are talking about outcomes you can expect, developing a sustainable process, one that reduces a lot of the pain points that you as an organization have, and moving beyond FML compliance to accomplish more with your overall absence process. The last 3 bullet points, which you can read, are really referencing what we view as an opportunity to reverse engineer a leave management process, understanding what various stakeholders in your organization want and need to help your operation perform, moving away from, again, what the carriers want to sell you over to what will accomplish your goals and objectives. You'll see throughout the presentation that we will reference the word operations. Whether you are in education, healthcare, manufacturing, or any other industry, the word operations is meant to include anyone who is responsible for managing the operations process within an organization. So again, the typical solutions in the marketplace are siloed. Workers' comp is in one silo. Leave management may or may not be supported internally by your organization or outsourced to a third party. A short-term disability may be self-funded, fully insured. Long story short, there are multiple processes that are leveraged to accomplish goals from a traditional standpoint in the leave management process. And what we're hoping to do in this discussion is to think more broadly about a process that will help optimize outcomes for every stakeholder in your organization. With that said, I'm going to turn it over to Michael Godwin, who's going to reference those stakeholders and their unique perspectives.
Thanks, John. Yeah, absolutely. Thinking about the varied perspectives, priorities, and focus of different stakeholders involved in this is critical to really understanding a company's needs, number one, and then designing a process that hits all the hot buttons and sort of looking at it from a macro perspective, not just a micro perspective, just in terms of HR, et cetera. So thinking about, the C-suite, company leadership, they're really thinking about, how does absenteeism, it can be a drag on our bottom line. What are the effects, and how are we going to make our organization more efficient and productive from a big picture perspective? And then drilling down a little bit further to John's point earlier about operations, that's really thinking about, we've got to have certain people in our organization working every day. And if somebody's going to be out, I need to fill that seat, fill that vacancy, and do it efficiently. So how can we design a process to do that and thus reduce overtime, improve our process performance, et cetera. Legal and HR, when we're talking about compliance issues, those are certainly top of mind for legal and HR departments with organizations across the country. And it really gets back into this conversation today about a consistent process, timely notifications, et cetera, to really cut down on compliance risk. Further, as it relates to HR, really helping to educate supervisors to have a consistent process to be able to follow that and to understand the changing world of FML and other compliance regulations, making that sustainable, and then driving that down further to employees to have a process that's consistent and repeatable such that employees know exactly where they need to go to notify of an absence and exactly what their role in that process is. And one last thing, just as it relates to HR, if there's any HR folks on the line here today, we certainly understand that you're probably sitting there thinking, well, all this stuff ends up falling in my lap. And we get it. We know that if there's any pain in these areas, ultimately they make their way to your desk. And so, really the goal of a conversation like we're having here today is really to describe how we can deliver a consistent process to reduce that pain and remove as much human error as possible from the possibilities here.
Thank you, Michael. So if we think about these stakeholders and we reverse engineer this back from an organizational needs standpoint, we often ask ourselves when we're going out to do due diligence, process mapping, and interviewing stakeholders in focus groups, so that would include employees, supervisors, HR managers, plant managers, local HR, legal compliance folks in an organization, what often occurs is that we hear from that supervisor who's the frontline person managing the operations of the organization. Again, operations meant to be a general comment for healthcare, legal, education, any industry you're in, operations, there's somebody on the front line that has to deal with absences when they occur. And that local supervisor will often tell us in these focus groups that what matters is that I, the supervisor, learn when that employee is not going to show up to work so that I can keep our business running by covering their shift. So whether we're talking about FML, workers' comp, short-term disability, the dog ate the homework, the employee just did not show up to work for whatever reason, the supervisor needs to know that that person's not going to show up to work, not so much what bucket they fall in. So the first priority is to accommodate these supervisor needs. This is their perspective, and this is often the tail that wags the dog in an ongoing FML lead management process. When the reality is we have to complement this with all the compliance aspects that end up on the HR team's lap, and those process outcomes that end up on HR processes, the HR lap, are often due to some inefficiencies in the process that came across the supervisor's desk in the process. So let's talk about why that's important. If we compare the typical traditional industry solutions to an operations needs, why is incidental absence an important aspect of that? And many of you may know what I mean by incidental absence, but on this graphic what we're referencing is that workers' comp, short-term disability, FML, state, military, bereavement, some of those types of managed leaves, those are all managed leaves that the traditional industry will give you a solution for. But what is often not provided a solution for are these so-called incidental absences, which could run the gamut. Again, inclement weather, employee out sick for one day, so not an FML or FCD situation, the car wouldn't start, the car broke down, the dog ate the homework, all the reasons that might lead to someone not showing up to work. The supervisor, the operations person, they need to know that somebody's not going to show up to work for any of these reasons, yet the industry wants to provide you, the employers, with a solution that is not all-encompassing, only focused on those blue areas. And so there's a disconnect between what the marketplace wants to sell you, solutions for the blue areas, versus what operations needs, which is notification that an absence is going to occur for any of these reasons, the blue or the green sections. So if we take an example here and follow just a very simple process map, inconsistent processes occur when a supervisor is in control of this situation. So we've already said that supervisors often are the first line of defense, receiving the phone calls from employees that they're going to be out of work. Those notifications may occur in very different ways. And you see 3 arrows there just to make the point that this could be a direct notification from the employee to the supervisor through a phone call. We've had situations where employees notify of their absence through a security guard, through a front desk, through the receptionist, through answering machines, through even sometimes an automated process. But in general, the way in which an employee notifies an employer of their absence varies not just by employer, but within employers, by division, by department. And so there's an inconsistent process with regards to how supervisors are notified. And that bifurcated process can lead to compliance issues. We do know one thing, that as soon as that supervisor is told that someone's not going to be out of work, if that turns into an FML leave, that conversation with the supervisor technically serves as notification, and the clock has now started on when timely notification out to that employee begins. So regardless of how that supervisor is notified with these various processes, once that supervisor hears about the absence, they are on notice. And some supervisors will handle that very well, and others with less experience may not be educated to the extent that they will know what they need to do with that situation. Now I've got 3 examples here that show what options the supervisor could have on getting that claimant into the absence management process. And there are certainly other options, but I'll just name a quick 3. The first would be that the supervisor tells that employee after the notice is given that the employee needs to go to the third-party entity to manage their claim, workers' comp, short-term disability, FML, etc. The supervisor in some situations may be responsible in an organization for mapping that process through from a reporting standpoint. In other situations, the supervisor may hand that off to a human resources professional locally or corporately, or they may ask the employee to contact corporately or locally an HR person. Bottom line is, once you've had multiplicity of processes on how the employee notifies of their absence, and you create multiplicity of options on how that employee gets to the adjudicator and the FML administrator, whether it be an internal person or an external co-source partner, you've now got multiple situations where leakage can occur in the process. And so that brings us to the next slide, which is just an example. So this is one example of an employer who, in a particular location, that supervisor tells the employee that they need to go through a certain process. So in this example that we've got here, the employee is told by the supervisor that they need to go to the short-term disability or the FML provider. And once that employee is told to do this, remember the supervisor and therefore the organization is now on notice of a potential FML leave, but now you've given the ball to the employee and we're leaving it up to that individual to follow through on the process. And if 90–95% of the employees does go to the FML provider, as an example, then that might seem at first glance as a good thing. But when you look at where the leakage occurs on the 3, 5, 7, 10% of the employees who don't follow through on the process in a timely manner, either they don't talk to that third-party entity in a timely manner or they don't report internally on a timely manner, that is where leakage occurs, where compliance issues can arise, rework occurs on having to back bill payroll deductions, on having to adjust point systems if you keep track of points for absences, and all that rework is part of the pain that arises by these leakages that occur in a typical absence management process. Now, if we look at incidental absences out here, the typical process, once the incidental absence, again, this is anything not otherwise managed, car wouldn't start, inclement weather, etc. Those incidental absences are provided to the supervisor, but once the supervisor knows that person is not showing up due to an incidental absence, the supervisor is on notice and they're filling the shift, but that reporting data is often lost, notwithstanding the fact that you may capture it in a timekeeping system. So here we have data coming into workers' comp if it gets there on a timely basis. And by the way, workers' comp is usually the most effectively run in an organization. But then you have gaps on short-term disability, FML, and each one of those silos, if you will, has reporting mechanisms, but they are at best bifurcated in most situations. Incidentally, remember that those incidental absences run about 4 to 5 times all of your absences. For every one managed absence, there are 4 to 5 times more than that of these incidental absences. That's the tail that wags the dog. Supervisors have to know about these incidental absences. So a potential process that we would like to suggest for your consideration, and this may or may not be spot on for every organization, but once we go through the process mapping to find out where your pain points are as an organization, we then come up with solutions such as this slide on slide 14. And that is creating what we call a funnel, a single funnel, branded for the employer. Michael will talk more about that in just a moment. But a single funnel where the employee calls in for any reason they're going to be out of work, for any reason they're going to be late to work, or for any reason they leave work early, or an early departure as we call them. Any reason the employee is not going to be at work, they go to this single funnel, an easy number to remember, and then this single funnel will route them to the appropriate managed care bucket, or if it's for an incidental absence, we'll certainly record that absence data. So a funnel could mean a lot of different things or could be structured in different ways, but an example might be a warm intake center, 24/7 access, 365 days a year, where a call center individual is taking every absence, departure, late arrival, and walking through scripts to find out if this is workers' comp, FML, STD, or an incidental absence, and then using the output from those scripts to direct them to the right party with safety valves and process checks to ensure that that handoff occurs. So when we have all these calls going through the appropriate third party, we've reduced the leakage, we've improved the aggregation of data, which we'll talk more about in a moment, and we've gotten the claim, when it's a managed claim and needs clinical intervention, like workers' comp or short-term disability, we've gotten that claim into their hands at the appropriate time. Why is that important? A claim manager who gets the call from a clinical standpoint real time is going to have proven ability to get that person back to work on a more rapid basis. Said another way, a process that has removed leakage is going to shorten your durations for disability and workers' comp. So if I'm in your shoes, I might be asking the question, here you told me in the first few slides that we've got to let the supervisor know that somebody's not going to be at work. So when we create this funnel, and this funnel gets the calls routed to the right place for the appropriate clinical intervention, the right call, right place, right time, right clinical intervention, how do my supervisors, which have to run operations, know how to manage their process? And this funnel would be designed, is designed, if this is the right solution for you, to provide e-notifications to that supervisor, either through text messages, emails, or even location inboxes and dashboards that would allow the supervisor to go in before a shift to find out who's not going to show up to work. So again, the supervisor gets what they need to manage the business. They get the details of expected return to work dates and even the phone number of the absent employee So if you're a paternalistic organization and you want that supervisor to call the employee, you'll certainly have that capability. But the outcome after letting the supervisor know of the absence is that we've now reduced the leakage, we've gotten timely notification to the right process partner, we reduced the durations, and then if you think about this, we now have all absence types coming through a single reporting mechanism. So the data is going to be aggregated into a singular database from which we can monitor and track performance. I'm going to turn it over to Michael, who's going to talk about change management tools to help this be easy for the employees. Go ahead, Michael.
Yeah, absolutely. And not just the end user employees, but the supervisors. John just talked about the supervisors and how they receive these e-notifications and how it really makes their lives easier. So big change here of going from where supervisors play a big role on the front end piece of this, really taking them out of that initial sort of intake phase of this. So a lot of training that goes on there, just to making sure they understand what their role is going to be and how this is going to benefit them in terms of interacting with employees. They'll continue to play a critical role, not just in receiving the notifications and what to do with that, but being sort of field-based advocates, if you will, to be kind of a first place that employees would go to with questions, et cetera. So making sure they understand the process in its entirety is very important. As it relates to employees, we'll certainly continue to utilize a lot of the traditional communication tools such as benefit guides, posters, et cetera, to get the word out about these processes. But a really unique thing that we've designed that's really the hub for all this communication-wise is a smartphone app that's custom branded for each employer. And this is the go-to place for employees to have access to this intake funnel. So we would set this up for the employer. An employee would have this on their phone, and it would be their routing point for all of the different absences, whatever they may be. Again, at the beginning, we've talked about how an employee is just thinking, listen, I'm going to be out. I don't really know all the differences in these different types of leave. I just know I'm going to be out and I need to notify someone. Make it very easy for them to do that through this smartphone app. Furthermore, it's not just going to be about absences. We can design it in such a way that it is a housing point for any other employee benefit communications that you have, such as advertising a telemedicine program or price transparency tools or other communication needs. And by pulling in other things like that, it becomes even more of a highlighted piece of an overall communication strategy, and it's just sort of baked in easily recognizable, if you will, for employees as their place to go to communicate with the company.
Thank you, Michael. And I would only add to that, if you think about a typical process, employees don't always know the difference in FML, STD, workers' comp. They just know they're not going to be at work. And instead of asking the employee and the supervisor to remember those nuances, we're giving them a resource so that the call gets routed to the appropriate place at the time. I'm now going to go back to a comment I made earlier regarding the reporting that can come out of this. So if all of these calls, for any reason, there is an absence, comes through a single portal, you've now got the ability to aggregate the data into a reporting and tracking mechanism. And so in this instance, on this slide, you'll see just a few representative samples of the power of the data. First of all, on the top left is a sample of an organization who had locations in multiple cities, and you can graph this out based on the volume of absences to see whether or not one location has a higher propensity of volume than another. And this becomes a reporting tool that you can do a flyover on your mouse, and it will tell you however you want to source this. It could tell you how many people were absent in a particular day by location, how many were tardy, how many had late arrivals, again at a macro level looking at an entire map of the U.S. If I were to click on Atlanta, which is where our headquarters is based, at that particular location, it would then pull up a chart down below that would show me not only what happened with a particular location, but how has that location trended over the course of time. And what you'll see here is that when you trend this out over the course of time, you can often see some trend that is emerging that needs to be looked into. And the data will not always tell us what is happening, but it will tell us something is happening and needs to have some scrutiny applied to it to make sure that there's no hiccup in the process. So if I were to ask the group the question, what is the biggest absence day of the year for the manufacturing industry, would you be surprised to hear that the largest absence day of the year, routinely, year in and year out, is the day after the Super Bowl? Secondly, the second largest volume day of absences in the year, and this will vary depending on region of the country, is often the opening day of hunting season. And while those are cute little examples of what the data might show, I think more operationally impactful to you all is that we also see trends develop in locations where there's supervisor turnover, where a plant manager may be out, a principal has gone out on leave, the cat's away, the mice will play kind of a dynamic. We've even seen spikes in union locations where there was unions came in and educated employees on how to utilize intermittent and continuous FMLA leave, and you see a spike in those particular locations. So again, you don't always know what the data is telling you, but it will often tell you something that will require some intervention. This is also a fantastic tool to monitor performance of supervisors, to just apply a little bit of that sentinel effect that allows us to see from a force ranking standpoint which locations are performing better than others from the absence standpoint. At the top right, I won't go through these in depth, but if a CEO walked into your office, a principal or the head of a hospital, whatever industry you're in, and said, how many people did not show up to work yesterday and for what reason, you now have the ability to report out everything bundled in one reporting engine, the answer to that question. And this can help significantly when you start going through policy changes, such as you change a PTO policy or you change your short-term disability plan design. It's good to look at this kind of a dashboard that will show you if the balloon was squeezed into something like workers' comp. So you get to take a more macro view of all absences, which can be a powerful tool from building an ongoing strategy standpoint. With just a few more minutes left, I'll summarize with this slide, and that is, again, moving from what the industry wants to sell you, which is often in silos, to a process that is more aligned with what you as an organization want to accomplish. And we do that through the single funnel, which again reduces the leakage. We help the employees in that process by making it easy to remember how to get into the funnel. This meets the needs of operations and leadership. Operations because they learn real time through e-notifications about the absence. Leadership gets what they want because they're able to have better reporting on how the productivity of the organization is running. You and HR, who gets all problems placed on your lap when they occur, now have process driving compliance instead of supervisors and employees driving non-compliance. So compliance is a big part of this and a big reason why you do this. And then also from an HR standpoint, this improved process and reduced leakage is going to reduce your administrative work, all those retro adjustments, payroll adjustments, point system redos from a performance management standpoint, and I'm sure you could add a half a dozen other things to the list, those of you in HR. The next to last bullet is increased speed of clinical handoffs. Again, if we can get nurses on the phone with the sick or injured folks on workers' comp or disability as soon as possible, the durations of those absences will be reduced. We say that matter-of-factly because we see it routinely. And then lastly, as I stated on the other slide, we have the improved reporting and trending analysis to help you monitor the performance of the organization and individual departments, divisions, or locations on a go-forward basis. A key comment, and this will be the last thing before I open it up for Q&A, is that if you're thinking about how to implement this, it is important to note you do not have to change your existing process. If you've got an FML a partner, a short-term disability partner, those are often the same. If you're doing FML internally, if you've got a workers' comp provider that's working, if you've got time management systems that are doing what they should do, keeping those existing processes and partners in place is absolutely commonplace. The goal here is to make sure that we're getting the employees into the funnel by bolting on a process that would simply complement or enhance the existing processes you've got. Now, if you haven't outsourced FMLA and you're looking to outsource FMLA, then obviously there would be some additional discussions that we would have there. But I wanted to make the point that if you're 80% buttoned up on this, some of these enhancements can be done without upending what you've already made progress around. With that, I'll pause and say that we have focused on supplying outcomes that are based on each stakeholder's priorities. And I won't read through all of those, but that's what we want to accomplish through thinking of this on a more global basis. And with that, I'll turn it over to the facilitator for any questions.
Thank you. And many have asked about the PowerPoint presentation today. Thank you. You can get a copy of the PowerPoint presentation either by contacting John Hearn, his email is on your screen, or Paul Nelleman from ACTEC, whose email is also on the screen. Though we're running a little bit long, we do have time perhaps for one question, and the most frequently asked question involved building a business case internally. What tips do you have for HR if they wanted to pursue this to get an ROI or to build the case internally?
Great question. Thank you. One that we commonly hear. So the business case for this internally is going to have a lot to do with your own organizational pain points. So if you're having compliance issues, if there's been any lawsuits developed, that's clearly a place that I would apply focus. The cost of compliance is far less than the cost of non-compliance. So I would build a business case around that aspect of things from a compliance. The risk of not doing things in a systematic way is something that you just can't do any longer. You cannot ride without your seatbelt on with regards to this particular topic. You will get a ticket, if I could use the poor analogy. The second area would be around overtime. If the topic of overtime is ever discussed within operations on we've got to get our overtime under control, almost every time overtime can be directly associated to absence management. And if an absence management with reporting and that sentinel effect that I referenced is put in place, that will have a direct impact on overtime. Those are just a couple of the ideas, but the main point is this reporting. You can't manage what you don't measure, and this reporting is a gift that will keep on giving because it's going to show you what's going on uniquely in your organization so that you as operations and HR folks can design strategies that will address the trends that are unique to your organization. I hope that helps.
Well, thank you very much. We'd very much like to thank ACTEC, Paul Nelleman from ACTEC, for sponsoring this webinar. Look for more webinars from ACTEC in the future on important topics such as absence management reporting or first notice of loss. And of course, the speakers from TBX Benefit Partners, the subject matter experts today, we can't thank you enough for this information. With that, this web seminar is now ending. We hope you all have a great day.